husband will blame it on the wife, wife will blame it on the husband. दोनों बोलते हैं भैया तुम खराटे बहुत लेते हो.
सही बात है, खराटे बहुत बढ़ गए हैं.
घर घर की कहानी.
More important in this is it damages the individual's health also. See, the mobile phone has become an appendage of the human body.
In last 30 years, I've seen professionals, entrepreneurs, and businessmen create magic. Millionaires have turned billionaires. But all of us are unaware of the fact that our daily habits are actually making us bankrupt. So what is the impact of these daily habits on our health? Impact of mobile phone, impact of environment, impact of flying, and how can we make little and subtle changes which can actually avoid us from a health bankruptcy. To discuss that, it is my honor and pleasure to welcome Dr. Divya Prabhat, ENT and one of the foremost authorities in the allergy care segment. Sir, so nice to have you in
Thank
Ages
you.
All Ours.
My pleasure.
Doctor, you've been looking into ears, nose and throats for about 30 years now. So if you have to really make a chart of public health crisis, how would you make that chart, especially in your core area of expertise?
As you rightly said, allergy is one of the biggest contributing factors to the health. And not only the environment, the food, etc. There are so many things which have contributed to this. So when I started my practice, which was about 35 years ago, the percentage of allergy affecting our population was around 10%. It used to be within a 10%. And today it has reached alarming areas of around 40%. And so this stark difference which has occurred over the time is due to multiple reasons. Those 30 years ago, we did not have packed foods, packaged foods. Today, the food which comes on the table does not come from the farm. It comes from the factory. That is the difference. So these foods that we are consuming, these packed foods, are having additives like excess of salts and sugars for making it addictive. They're having coloring agents which make it more attractive. They have emulsifying agents, they have preservatives, so there's a long shelf life. So what we are consuming as packed foods is really one of the bigger causes for allergy.
Doctor, in the pursuit of productivity, all of us are now today attached to our devices. What is the long-term impact of excess mobile phone and what are the studies indicating? And what is your definition of excess mobile phone? The red line, you should not go beyond this. 1 hour, 2 hours, 3 hours.
Okay. See, the mobile phone has become an appendage of the human body. So first thing is, you should keep it a little away from the body. Even iPhone, BlackBerry, all of them have mentioned in their manuals that the distance, minimum distance should be 15 millimeters away from the body. So when you're getting a call, don't keep it close to the ear, keep it at a little distance.
कोई सुनता है सुनने दो.
कोई सुनता है सुनने दो. बिल्कुल, बिल्कुल. दूसरी बात यह है कि when you are using the mobile, your call should be not ideally as short as possible. If required, maybe you can do a text or go on a speakerphone. I would suggest that if you're traveling, avoid speaking on the mobile because signal gets transferred from one tower to another tower and the mobile keeps on searching. So therefore, there is greater radiation which is generated. Okay. This is non-ionizing radiation, but still somewhere or the other it is similar to, akin to, you can, all of you use a microwave. So the same wavelength is there with a mobile phone also, but we don't put our head inside the microwave. So always, if you're traveling, try to avoid your call or these long calls when you're traveling. Especially again, when you're in a lift, the signals are less and the mobile phone signals increase. The radiation is much more in a lift. If you're traveling in a tunnel, avoid using mobile phones. So these are the places where the damage will be maximum.
So I have these jars here, doctor, now, and you can, as a doctor, I want a brutal verdict from an ENT that what is bad for the ear and what is good for the ear. The use of hands-free while talking on phone, and even it's a long call, red or green?
Green.
Earbuds, and you can now see it's become part of your body. Which basket will this go in?
Red.
Why will it go in red?
It will go in red because first of all, when you're using the AirPods, the external canals get blocked. There is humidity in the ear canal, and we see a lot of patients who come with infections. So bacterial infections, fungal infections, first of all, become higher. Secondly, when you're using AirPods, you're totally cut off from the external sounds, absolutely. And that would limit your communication, your social activity all gets cut off, because people I have seen who put in these pods, they put it in the morning until evening, they are into this only. So they get totally cut off from the world itself. So social communication, interaction is also very important as far as human health is concerned. In fact, it is one of the prime factors for longevity now, in all studies they have shown. So avoid using these because people put it and they use it for the whole day. So I would put it as no.
Okay. So if I have to make a doctor's prescription on how to talk on the mobile phone, first, minimize your chats on the mobile phone. Start with a speaker phone if you can. Avoid it during transit, especially during lift, because as you go higher and lower, the frequency and the radiations will change.
Exactly.
Certainly avoid AirPods, and hands-free is something which you would actually recommend.
Yeah.
But what is science indicating, and what are the long-term side effects of excess use of mobile phone? Is there a study which in a sense substantiates it, or right now share aaya?
Yeah. Basically, you have studies from both the sides. Exactly, nothing has pinpointed that it alters the DNA of the cells. It is a non-ionizing radiation. But I'd just like to remind you that even when cigarette smoking or tobacco was initially advertised, doctors were on the caption, and they all promoted it as it gives good health, it makes one slim, etc. And now, after so many years, you see the caption which is there on these packets, how the caption has changed. So it took 40 years for the world to realize that cigarette smoking is harmful. It took 40 years for the world to realize that asbestos is harmful. It took 40 years for the world to realize after a nuclear bomb that some DNA changes have taken place, which was not realized initially. So presently, things that we do not know should not be considered that they don't happen. We have to take precautions. We see patients, I have seen patients with who were on a single call. He had a call for 2 hours and then finally developed ringing sound in the ear, which we call tinnitus, and not damaging his hearing. I have patients, I have an MP, who had come. He said 3 months I was continuously using the mobile because I was campaigning in my territory before the elections, and that tinnitus became incurable. So thing is that even one call can affect the ear. So therefore, keep the call as short as possible. Use it as hands-free, as you rightly said, and avoid using it, especially when you're traveling.
Okay. So now we've got a doctor's prescription on how essentially we can maximize from our devices and how we can actually minimize the impact, at least on our bodies.
Exactly.
There's another modern, I won't say hazard, but another question which keeps on popping up is that kaan mein khujli aa rahi hai, kya kare? And I know people, they simply go and they grab a earbud. So if there's a earbud, should I be using it at all?
Absolutely not.
Absolutely not.
Not.
You're saying absolutely not.
Absolutely
so it goes
not.
Here.
It goes here in
so
no.
Earbud should not be used at all.
Absolutely not.
Now why is that?
Now when you use a earbud, you see the size of the bud actually which you have shown is similar to the size of the ear canal. So it is no way that it can clean out the wax. Secondly, wax is a natural collection and it is thrown off naturally. We should not interfere with nature's method, and wax is always rich in antibacterial agents, lysozymes, immunoglobulins. The person who has wax, we rarely see an infection in the ear. The wax is a protection also. So first of all, you need not remove it. And while using buds, the wax which is produced in the outer 1/3 of the ear canal is pushed into the inner 2/3 and it becomes impacted, and then you maybe you have to rush to the doctor to remove it. And
Do you see patients who actually...
A lot of patients. In fact, today morning I've seen somebody who has perforated his eardrum with the bud.
Just the earbud.
Yes, I have this 32-year-old boy. I mean, today morning I've seen.
One out of what, every 100 patients, or 2 out of every 100 patients who actually have earbud damage?
More than that. I think you can say in 30-40 patients you have somebody comes with earbud
so
issue.
2 to 3% patients.
And what happens is the earbud has certain fibers. I mean, this is not the trauma, but the wax, it gets stuck. The hair fibers of the bud, cotton, they get stuck, and this leads to fungal infection. So fungal infections occur with earbud users quite a lot.
Okay. I'm going to remove the jars here and talk about something which ghar ki kahani hai. Husband will blame it on the wife, wife will blame it on the husband. दोनों बोलते हैं भैया तुम खराटे बहुत लेते हो. Is it has snoring increased in last 10 years? If yes, why?
सही बात है, खराटे बहुत बढ़ गए हैं मतलब. और the thing is, it is not only the disturbance to the husband or wife, I would say. More important in this is it damages the individual's health also. Now, why does one snore? When air passes through a narrow area, it produces sound. And this narrowing occurs most commonly with, again, we come back to allergy. Commonest causes allergy where there is a narrowing of the airway. So, if the nose is blocked, for example, what would happen? Unconsciously, the brain will stimulate and open the mouth to increase the oxygenation. And as the mouth opens, the tongue falls back because tongue muscles lose their support, and the back of the tongue closes on the wall of the throat, the pharyngeal wall, and this produces the sound. So this is called as snoring. Now, if this snoring is persisting for a longer period and it reduces the oxygenation, the person stops breathing for 10 seconds and you have similarly 7-8 episodes in a full night's sleep, it leads to a condition which is obstructive sleep apnea.
Okay.
So apnea is cessation of respiration, and this is because of the obstruction, and this obstruction is because of the narrowing of the air passage.
Is there a cure? Is there a medicine? Is there an exercise which you can perhaps share with our viewers?
First of all, very important that one should be a nose breather.
Okay.
Because the nose is it's an excellent state-of-the-art, sophisticated filter. You see your whole market for air purifiers, but first of all, use your own air purifier, which is so good. So the nose has triple this filtering mechanisms. So it filters the air, cleans the air, humidifies it, and takes it down to the throat and to the lungs. So not only filtering the air, it also produces nitric oxide. It improves the oxygenation at the level of the lungs. So it helps us in, to a certain extent to improve oxygenation. The nose helps us to keep the oral cavity normal, because if one becomes a mouth breather, saliva dries up, gum infections, oral infections become much more, dental infections are more.
So मुंह बंद करिए, मुंह बंद रखिए जो बड़े बुजुर्ग कहते थे. But consciously, how can you develop it? Because I'm breathing through my subconscious mind. While you and me are talking, I don't know whether it's my mouth or whether it is my nose. So if somebody says, okay, thank you doctor for telling us and enlightening us with whole concept of breathing through our nose, how do I do it where I'm not conscious about it?
See, first of all, your nose has to be open. If there is some sort of a deviation, etc., that may require to be corrected. So we are keeping that aside. Secondly, why does one become a mouth breather? One becomes a mouth breather when one is overworked, one is stressed. One is in a fight and flight state where there is more sympathetic activity. One is stressed, one is worried, one needs more oxygen. So it's a sympathetic state which makes us a mouth breather. But what happens that from this sympathetic state, when we again move to a parasympathetic state, by habit, we continue mouth breathing. So we have to constantly remind ourselves, make it a habit, and automatically you will start breathing from the nose.
You've seen patients who have done that, who achieved that when you've told them? Is it possible? You've seen patients who managed to achieve it?
In fact, meaning even in the children, we keep on telling them, the parents remind them, it takes 1 month, 2 months, 3 months, and they become nose breathers actually.
Okay, so become a nose breather, another prescription from doctor, which is that in a sense will certainly reduce your snoring and certainly reduce your bedroom fight. husband will not blame the wife and wife will not blame the husband. खराटे कौन ले रहा है?
कराटे।
दोनों के खराटे बंद हो जाएंगे.
बट इसके साथ एक और चीज है जो ध्यान रखनी चाहिए, जिसमें स्नोरिंग बढ़ता है, पर आपको तो नहीं बोल सकता, nobody can be more fitter than Nikunj ji. One has to lose weight. Obesity is one factor, because that obesity you find increasing now. And by losing weight, you know, a lot of them, even meaning the snoring just disappears. So, and the way of sleeping also. If one is a snorer with even some obstruction, it is better to sleep either on the left or the right position, you know. So
Like
avoid
turn like
sleeping
this and
supine,
sleep.
left lateral or right lateral. And if it is too much or one is obese also, one can avoid snoring trying to sleep on the stomach. So positioning can also help in reducing snoring. If there's a nasal congestion, one way is to use a double pillow, keep the head a little high. It will also reduce nasal congestion. So when we tell them to stop breathing from the mouth and to breathe from the nose, we explain to them, counsel them as far as positioning of sleep is concerned, weight is concerned. We teach them exercises of the mouth and the neck to prevent a tongue fall. It is called as myofascial exercises. So, you know, a lot of other things are done along with, you know, just like telling them to breathe from the nose.
Are you a big proponent of pranayams? You think they will help?
Definitely. The word pran in Sanskrit means life, it means breath. So actually breath is life. So pranayam is indispensable. I mean, it will really help because it gets the parasympathetic state of a person. It reduces the pulse, it reduces the BP, the vagus is stimulated, and therefore pranayam should be done.
I'm reading suddenly a lot about vagus nerve. What is a vagus nerve and why have you mentioned vagus nerve almost 3 times in our conversation?
The vagus nerve, the 10th nerve, the nerve vagus means vagabond, you know, because it moves all over the body, even in the ear, it goes into the GI tract, the stomach, and so on. Now, this is the parasympathetic nerve. Now, as you know, you spoke of pranayam, like I'm talking of anulom vilom, for example. Now, you have the yin and yang, you have the sympathetic, parasympathetic stimulation. So, parasympathetic changes you from the sympathetic by taking you to the rest and digest stage. So therefore it reduces the pulse rate, it reduces the heartbeat, that is, it brings mental calmness, removes anxiety, and it gives a state of well-being. In fact, in the ear, now there is a branch of the vagus. Now even that will give you an indicator that why the people use earbuds. They take the earbud, put it into the ear, they feel so nice. The nerve is called as Arnold's nerve, and this nerve, when stimulated, stimulates the vagus and causes the parasympathetic stimulation, and a person feels nice.
How can I take care of the vagus nerve so that it can take care of me? Because if the vagus nerve is connected to my GI tract, to just about every major organ, I need to take care of my vagus nerve. So what can I do every day which can stimulate my vagus nerve?
Yeah. So basically, most important for the vagus nerve is your right way of breathing. Breathe slowly. And be mindful. Be basically relaxed. Exercise well.
Is there a yoga? Is there a technique?
The technique you can do anulom vilom, which will stimulate the vagus. You can do Brahmari, which will stimulate.
What is Brahmari, doctor?
Brahmari is, you know, you have to close the ears.
Can you demonstrate that for us?
Yeah, you close the ears. Keep the, see, basically what you are doing, I'll just explain it to you. You close all your senses.
So I put my thumb
in the ear canal. Your
Do I take out my glasses?
Yeah, you can remove the glass. You can close the eyes. Close the nose. And your mouth will be closed. Okay. And do the humming sensation. That is, Brahmari is a B. So humming sensation is done, and you will get the sound in the ears.
You suddenly feel your mind has got a frequency.
Exactly. So you're stimulating the parasympathetic nerve.
How many times should I do it every day?
You can do it 15 times, you know, ideally, and preferably do it on an empty stomach.
Okay. I have, you know, I fly a lot.
Yeah.
And while flying is the ultimate productivity booster, it has its own challenges, which is that you got airplane ear, you get a lot of pain in my ear. I've personally suffered with it, and you've actually fixed it. when I actually had what was called as otis media.
Yeah.
So for those who fly a lot, is there a genuine case to be worried about, because aeroplane flying could have an impact on your ears, your nervous system?
Yeah.
Was I unlucky, or that is a common problem?
Yeah, it's quite a common problem. Now, those who are flying frequently have to make sure that they don't have a cold, a simple cold, common cold before a flight.
Okay.
So, if they have a cold or a common cold and they cannot alter the schedules, of course, with everybody being so tied up with time, they can start decongestants, nasal drops, which will open up the sinuses, open up the eustachian tube. So, they need to take this medication 2 days prior to a flight. Secondly, once they get into the flight, one thing is they can either use a cotton plug into the ear, or they can use a ear plug to reduce the pressures onto the ear canal. Third, what they can do is, before a takeoff, either take a sweet or a chewing gum and keep on swallowing it or sucking it so that the eustachian tube opens.
I've seen that babies are given a lot of
yeah,
things
they are
to
given.
chew.
In fact, earlier, when it was Indian Airlines, I remember they used to give a Raval gum sweet. So these sweets, cotton, and also one should remember that during takeoff and landing, when the pressures are changing so drastically, one should not go to sleep.
Okay.
Yeah.
Very important. One
Because
should not
once-
sleep before takeoff and just before landing.
No, during the process of it, because what happens that when we are sleeping, the eustachian tube muscles don't function, and therefore the eustachian tube does not equalize the pressure. So don't go to sleep at that time, and with these things, your ear will remain safe.
Is there a hack? Is there any exercise, any yoga which I can do?
Right. So in case these don't work and still one feels that the ear is getting blocked, what is called as a Valsalva's maneuver can be done.
Okay.
With the thumb and the index finger or the middle finger, just pinch the nose, keep your mouth closed, blow air
I can
in
hear
the
some-
ears,
I can feel
and
some
you can
popping.
get a crackling sensation in your ear. That is called as Valsalva's maneuver. And if that is difficult, one can just close the nose. It is Toynbee's and swallow saliva.
Okay.
So these maneuvers can be done, which will open the eustachian tube.
I'll talk about something very basic, which is common cold. What is the best way to treat common cold? Because now it's perhaps fashionable. I won't use fashionable, but I would also say easy to find antibiotics. You have a cold.
Yeah,
you can
in
just open
common cold,
antibiotics.
in common cold, if you use antibiotics, it clears in 7 days. And if you don't use antibiotics, it clears in 1 week. So there is no role of antibiotics per se in a common cold, which is generally allergic or viral. Very important, have a good hydration, eat well, take a good 7-8 hours rest, sleep, and it clears up.
Are you a big believer in supplements? All kind of crazy supplements are there. They have tall claims. I don't know how much of that is backed by science, but at least the marketing, I think, is unreally realistic. Are you a big fan of them?
I think one should eat food as a medicine. One should eat food as medicines, otherwise later one would eat medicines as food.
Okay.
Supplements, again, I spoke that we should not have packed foods. So I would prefer you to have it as natural as possible. More cooked the food, more harmful it will be. It will lose its nutrients.
So stick to what nature gives you. I mean, there is a reason why
Exactly.
nature is seasonal.
Exactly.
गर्मी में आम खाने का और सर्दी के अंदर मटर खाने का.
मटर खाने.
So
बिल्कुल,
just stick
बिल्कुल.
to what the basics
What
are.
basics are, and at the same time stick to what is grown locally.
We started the show with allergy. So in terms of an allergy, are we going through what could be called as an unknown but an evident allergy crisis? Whether it is coughing, whether it is nose congestion, whether it is perhaps having skin rashes, are we going through what could be called as an allergy unknown crisis in India?
Definitely, in fact, the incidence of allergy, as I said, has grown from 10% to 40%. In fact, you will get an idea that even in our city, or when we're talking about Bombay, when I tell my patients go and at least otherwise have an air purifier in your room, air purifiers are not available. I mean, they're so much in demand. So you can imagine the the AQI today is around 200. So the allergic component is increasing to that extent that we definitely will go into an allergic crisis sooner.
So, what is the first shield to protect yourself from allergy? When we travel, when we go to public places, should we just wear that mask? Yes. Don't go by what people will think. It is just simple, basic shield which you need to have now.
Yeah, right. I mean, the mask will definitely help us, and preferably an N95 mask if you are in a place which is, having a very bad AQI. For example, if you go to Delhi, for example, it is definitely worth wearing a mask. But most important in allergy, I would feel that it is not just the atmosphere. You have to also make yourself strong. That will help us in combating allergy. And once you make yourself strong, automatically allergy, the body response is good. The effect of allergy on the body becomes less. On that, I can even,
So, doctor, when you are looking at the entire curve of a patient recovery, how much role in a patient recovery is a function of medication and how much is a function of pure willpower?
In fact, both of them are important, but willpower is very important as far as recovery is concerned, because with a positive mind, positive willpower, we see patients recover also much faster and much better actually.
So, have a positive willpower.
Definitely have a positive willpower.
A lot of, I would say medically, a lot of doctors have said you're suffering from BP because it is genetic. The first question a lot of doctors have personally asked me, is there a family history of diabetes? Is there a family history of blood pressure? Is there a family history of cancer? They ask you these questions before you even write the prescription.
Right. Okay.
Is there merit in really looking at family history? Is there merit in the genetics will overlap each other?
Yeah, I mean, certain conditions run more in families, that is right. But along with genetics, there is something which is epigenetics. And this can be compared to a loaded gun. It's a loaded gun, it is totally loaded, but for that loaded gun to fire, you have to press the trigger, and this trigger is epigenetics. So if you can control epigenetics, you will prevent that loaded gun from firing.
So, अब डॉक्टर आए तो प्रिस्क्रिप्शन तो बनता है. तो अगर आपको एक प्रिस्क्रिप्शन लिखना है, प्रिस्क्रिप्शन ऑफ गुड हेल्थ, इट इज मोर प्रिवेंटिव, इट इज नॉट क्यूरेटिव. सो डॉक्टर साहब के प्रिस्क्रिप्शन में क्या बात आएगी?
मेरे प्रिस्क्रिप्शन में सबसे पहले, जैसे हमारी बात हुई नेचर की, आई वुड पुट a circadian rhythm. Follow a circadian rhythm.
What is a circadian rhythm?
Circadian rhythm, आप जैसे सूरज उगता है आप उठ जाइए. Don't eat after sunset. So follow the rhythm and keep it to the body, so that will improve your health to a great deal. So that is very important. Secondly, I would say avoid preservatives, packed foods, because you are what you eat. So therefore, eat what is grown on plants, more natural food rather than what is made in plants. So your food forms a big criteria to it.
Okay.
Third would be stress. Stress is a factor which increases the cortisol levels in the body. It causes inflammation of the whole body. So try to be relaxed, where we spoke of some Anulom Vilom, Brahmari, relaxation, etc. That is important. And lastly, the fourth pillar I would say would be exercise, physical exercise. Like now, sitting is the new smoking, etc. So as much as you move, it is better. Be mobile. And even for your brain, unless you stimulate the brain, because I feel it's either use the brain or lose the brain. So if you don't use the brain, you will lose the brain. So using the muscles and the brain. So these would be my 4 factors as far as my health prescription is concerned.
So you cannot compound your wealth if you are really depreciating your health. So I would urge everyone, rethink your tech to simple things like breathing before you fly, and also just focus on the food you are really eating. Like they say, if money is lost, nothing is lost, but if health is lost, a lot of things are lost. Thank you, doctor. Thank you for joining us, and thank you for your lovely insights.
Thank you. My pleasure.